Je m'appelle Gladys Obale. Je suis représentant de Purple Rose, une organisation basée ici à Middlesbrough et Stockton pour bien-être des femmes. Et ce matin, je parle avec Kathleen Handy de NHS, qui est femme sage qui présente la localité de North East et qui s'occupe également des femmes enceintes. Hello, Kathleen. What urgent message do you want to share with women of French-speaking community, and why is it important during this COVID-19?
Hi, Gladys. Thank you, and thank you for helping us today. As you said, I'm Catherine Hardy, and I'm a midwife, and I lead on the local maternity services across the North East. We're really concerned because recent analysis by Oxford University shows that COVID-19 has a disproportionate impact on Black, Asian and minority ethnic pregnant women. They're all at increased risks of becoming unwell with COVID-19. Black pregnant women are 8 times more likely to be admitted to hospital with COVID-19 than white pregnant women, and Asian women are 4 times more likely. This concerns us. We don't know why, but the government is taking it seriously and has commissioned research to find out. Meanwhile, we want to make sure the NHS is doing everything we can to reach out to reassure and support these pregnant women and new mums most at risk. So we want to share some important messages. Firstly, we want to advise pregnant women to get help early. Don't delay. It's very important to act quickly if you're worried about the health of yourself or that of your unborn baby. For example, if you think that the baby's movements have changed, please get in touch with the maternity unit that you are booked to have your baby immediately. And we want to reassure that pregnant women that maternity services are available whenever you need them. Services for pregnant women are running throughout this horrible pandemic, but we want to stress that women should always attend their appointments unless they have symptoms of COVID-19.
Merci Kathleen pour votre aide ce matin. Et comme vous avez dit, nous sommes très inquiétés parce que les analyses de Oxford University montrent que les femmes noires sont plus exposées au COVID-19 que les femmes blanches et les femmes asiatiques. Et nous ne savons pas pourquoi. Et cela inquiète vraiment l'État. Et l'État est en train de faire tout pour mener les recherches, de voir profondément ce qui ne va pas. Et il faut que les femmes enceintes sachent que l'État les soutient. Ils vont faire tout et tout pour voir vraiment ce qui ne va pas et de donner le soutien moral et le soutien, tout le soutien qu'ils pouvaient lui donner pour que les femmes enceintes soient en santé et les bébés également. Nous ne savons pas pourquoi cela vraiment. Et enfin, nous conseillons aux femmes enceintes que à tout moment, s'ils sentent que la santé de leur bébé est en danger, peut-être le bébé ne marche pas, ne mouvementait pas comme il fallait, qu'ils n'exigent pas vraiment de chercher l'aide au niveau de les femmes sages, parce que il est vrai qu'il y a le COVID-19, mais cela n'empêche, les femmes doivent toujours aller à leur rendez-vous parce que les maternités sont ouvertes 24 sur 24. Comment les femmes enceintes peuvent accéder aux services maternité locaux? Hello, Kathleen. How does someone make contact with the maternity services to get help?
So Gladys, all women have a community midwife and must book with a community midwife as soon as they think they may be pregnant. So the community midwives link to the GP. So if you're pregnant and haven't booked in with the midwife, contact your GP now to be put in touch. There is interpreting services available too. So again, once you contact the GP, tell them what language you need and they will organise the interpreter to be present at your appointments. During the pandemic, combination of virtual online appointments and telephone and face-to-face are being undertaken. And this depends on what the reason for the appointment is and at what stage of pregnancy you are. So again, the midwife will let you know how they will contact you. Check with your community midwife or hospital where you're booked to have your baby if you can bring a partner in on your appointments. Most hospitals are trying to release restrictions, but you might only have to go by yourself because we can't accommodate everyone because of the size of the rooms. We know the pandemic outbreak has caused some people to worry about seeking help, and there's been a decrease in attendances at some services. So we want to reassure people that the services are safe. Social distancing is practiced wherever possible. This is why restrictions are in place, asking women to attend appointments alone, as the waiting rooms and the scan rooms are too small to allow the social distancing to occur. Strict hand washings in use. Extra hand washing facilities and sterilising gel is available all over the hospitals. Face masks are readily available. All staff wear PPE and change between each patient. There is enough PPE. Rooms are disinfected after each patient and equipment is disinfected. All patients are swabbed as soon as they come into hospital, even if they do not have any COVID-19 symptoms. And also, Gladys, it is very important that women think about taking vitamin D. Vitamin D is important for health. Women low in vitamin D may be more vulnerable to COVID-19, especially women with darker skin or those who always cover their skin when they go outside. So they may be particularly at risk of vitamin D insufficiency. Vitamin D is found in a small number of food, such as oily fish, red meat, liver, egg yolks, and fortified foods like fat spreads and breakfast cereals. So you can get vitamin K from that, but you could consider taking 10 micrograms of vitamin D per day. You can buy them at supermarkets and pharmacies. Stick to the recommended dose, otherwise it can damage bones, kidney and heart. And you can get vitamin D from the sunlight, but can't overdose on that.
Les futures mamans doivent connaître que toutes les maternités à travers la région de North-East sont ouvertes pendant cette période de COVID-19. Les femmes enceintes doivent respecter tous les rendez-vous de prénatal, sauf s'ils présentent les symptômes de COVID-19. Et les femmes doivent aussi connaître que pendant les rendez-vous, ils peuvent amener les partenaires. Il est vrai que dans certaines maternités, il n'y a pas ainsi d'espace parce qu'on doit maintenir distance, mais cela n'empêche, ils pouvaient toujours aller avec les partenaires. Il doit aussi connaître qu'à ce moment, il y a toute sécurité. Il y a vraiment le PPE et tous les masques. Chacun doit aussi porter les masques. Il doit aussi également connaître que pendant la grossesse, l'enfant a besoin de vitamine D. Le vitamine D peut s'obtenir en mangeant le poisson gris, en prenant les comprimés et à s'exposer au soleil. Et les femmes aussi doivent connaître que leur santé est très importante. S'ils ne se sentent pas vraiment à l'aise, qu'ils constatent, ils partent voir les médecins qui en fait va aussi contacter les femmes sages. Les femmes sages sont prêtes à tout moment et ils sont ouvertes que toutes les femmes doivent respecter les rendez-vous maternité, les prénatales. Ils ne doivent pas exiger d'aller à l'hôpital.
So, Gladys, can I remind everyone to call NHS 111 if you have any of these symptoms? A raised temperature in the last 24 hours above 37.8 degrees C, a new dry persistent cough, loss of smell and or taste. And please continue to follow the government advice to prevent the risk of getting COVID-19. Wash your hands regularly, maintain social distancing, and wear a face covering.
Il y a aussi un message très important que la femme sage vient de dire tout à l'heure. Il y a les symptômes de COVID. Si par exemple, vous perdez le sang, vous ne sentez pas. Si par exemple, vous avez la température, n'exigez pas les femmes enceintes d'aller voir votre médecin qui est vraiment là pour vous et lui, il va contacter la femme sage. Et vraiment, n'hésitez pas aussi d'appeler le 111. Ça, c'est le numéro de NHS, le numéro d'émergence. Si vous avez vraiment besoin de contacter l'hôpital rapidement, appelez le 111. Et aussi, vous devez, les femmes, garder la propreté en lavant les mains, à porter les masques et à garder la distance sociale. Nous voyons dans le médias sociaux que le COVID-19, c'est une maladie fabriquée par l'homme et que on va aussi utiliser les noirs comme les guinea pigs dans le laboratoire. Tout ça circule dans les médias sociaux. Est-ce que c'est fondé? Kathleen, we see stories being circulated on social media that COVID-19 is a man-made and genetically targeted at the BMM community. They say it is a natural virus. Why does it affect BMM people more? We also see stories that BMM people are secretly being used as guinea pigs for testing new drugs and vaccines for COVID-19. And so people are being deliberately affected with it when they access the NHS. Can you please throw some light on these allegations?
Thank you. Gladys, viruses do mutate naturally and sometimes create forms that humans have no immunity to. There is no evidence that this virus is man-made. We don't yet know why it adversely affects the BAME community more. However, research is being undertaken to find out. There are worries that perhaps the BAME families don't get help quickly enough because they're afraid or because they don't think they are ill enough. And then by the time they do seek help, they are severely ill. And this is why we're urging pregnant women not to stay at home thinking they'll get better. Please get checked over, even if you don't feel very ill. And I want to reassure everyone that we're in this together and that no one is being used as a guinea pig for testing new drugs without their consent. Some of my doctor friends have volunteered to help find a vaccine. The check-in process for taking part is very strict. So I want to reassure everyone that we're working on finding a vaccine to protect us all, but this has been undertaken with very strict processes as not to put anyone at risk. There's no current vaccine available for COVID-19 or no current medication that has any effect on this new virus. Many universities across the world are working on a vaccine to protect us all, but this isn't expected to be ready soon. So as it must go through vigorous checks before it is perceived to be safe. When a vaccine to protect us all is available, there will be a national campaign for everyone to receive the vaccine, regardless of race or ethnicity. I'll certainly be having mine. We'd be very worried if anyone believed they're immune by taking some untested drug or believing in a false claim. They could be putting themselves and their families at risk of infection with COVID-19 if it means they don't take the precautions of washing hands, social distancing, wearing a mask. Thank you, Gladys.
La seule solution pour le COVID-19, c'est le porter des masques et les laver les mains à tout instant. Les médias sociaux circulent les informations qu'on est en train d'utiliser les hommes comme les guinea pigs et que le COVID-19 est une maladie qui est fabriquée par l'homme. Ça, c'est faux. Les vaccins sont en train d'être faits. Il y a les docteurs qui sont en train de travailler jour et nuit pour faire qu'il y a les vaccins, pour vacciner le moment arrivé tout le monde. Personne n'est utilisé comme le guinea pig. Personne. Il y a les gens qui croient que le COVID-19 est une maladie que l'homme a fabriquée dans un laboratoire. Tout ça, ce sont les fabrications, les mensonges que les femmes enceintes surtout ne doivent pas écouter. L'État est en train d'assurer que les vaccins soient disponibles et le moment arrivé, ça doit être admis à tout le monde. Ça prend du temps et le moment arrivé, on constatera. Kathleen, pour expliquer tous ces messages. Thank you, Kathleen, by throwing more light on this false information circulating on social media.
Thank you, Gladys. And please get in touch with me if your community has any other questions or concerns. We're here to ensure pregnant women in your community get all the support they need for a safe pregnancy and birth.
Et s'il vous plaît, n'hésitez pas de contacter votre femme sage si vous avez les symptômes et si vous êtes enceinte pour la santé de votre futur et votre santé également. Merci.
Merci.